joining us today, and we will, as Wendy said, unmute everybody at the end of the demonstration or throughout the demonstration, so there can be some interactive dialogue with Raul as you have questions as he goes through it. Raul Valdes-Perez co-founded OnlyBoth in March of 2014 and is the CEO. He co-founded Vivissimo in 2000, a search software company that provided enterprise products and web-based consumer services, and served as the CEO there for 9 years, and as a chairman for 12, until its acquisition in 2012 by IBM. The three-person company exists because they have completely rethought the benchmarking task, also known as comparative analytics. Benchmarking is common throughout business and government, but hasn't seen any advance in methodology for many years. And that's where Raul has used his academic expertise in an AI-style automated reasoning and writing and web-centric services. So with that, I'm going to turn it over to Raul right now as his screen is being shared with you to demonstrate Benchmine for everybody. Thank you.
Thank you, Chris, for that introduction. Can I be heard? Yes?
Yes, Raul.
Okay. Well, good afternoon to everyone. I am actually not in Pennsylvania right now. I'm on a trip, and I will explain where I am shortly. But so, as Chris was saying, we are a young company. We have a new technology. We've automated a task that arises very often throughout business and government, and we have a special focus on healthcare, where we can make the greatest positive impact. So here's why. So there's been a lot of work and advocacy of transparency within healthcare as a public good, and also because transparency can help to drive performance improvement. There has been a tremendous effort, as everyone knows, on creating measures to express healthcare performance, basically the creation, the definition, and the collection of data. And also there's been a lot of advocacy by thought leaders and scholarly writing on transparency driving performance improvement. The pathway by which it drives performance improvement is subject to discussion. I won't go into that now. What's missing from all this was actually noted in one National Academy of Medicine report, that the public reports on healthcare transparency often are cognitively burdensome for the audience. That's the phrase that they use. We think we can fix that. So my purpose here is to thank you for the invitation, to give a demonstration how this applies to nursing homes in particular. The goal of ours as a company then is to build upon what has been achieved in data and in intellectual advocacy by offering this software automation and to take healthcare transparency to new heights. And this can be applied to both public and to proprietary data. So that's kind of the introduction to our company. Now, I believe that yesterday there was circulated a one-pager that had a list of sort of 10 different innovative capabilities of this approach to benchmarking. Since then, I actually wrote it down as a blog post. So if you're interested in looking at it, you can go to blog.onlyboth.com, which is basically the one-pager, but accessible via the web, where you can click on the links that are there. So these are 10 different aspects that underlie the novelty or the scope, the innovative scope that we claim for these benchmarking engines. So I'm going to walk you through some examples here. Okay, the front door for these engines is benchmine.com, which consists of 7 different healthcare benchmarking engines corresponding to different compare data sets from Medicare.gov. Okay, they're all listed here, including hospitals, and here are nursing homes, and then there are 5 others. We haven't done physicians, not too satisfied with the quality of the performance or the richness of the performance data for physicians as is publicly available. So we'll get to that at some point. So this is the front door, and then one can click on, in this case, nursing homes, and I'm going to walk you through a specific nursing home. So I click on nursing homes, and it takes me to this search box where I can type in the name of a provider, or I can do some other things. The core capability here is to see or to learn where a provider, in this case a nursing home, stands out compared to others nearby and nationally. Now, I could have picked a place in Pennsylvania to illustrate, or maybe some place just over the border in Ohio or in West Virginia. But I decided, what the heck? Right now I'm in Miami Beach. I'm not at the beach. I'm just in Miami. Miami Beach is a municipality, of course. So I'm going to start it off by just typing in Miami Beach here, comma, Florida. And it turns out there's only one nursing home in this government data set in Miami Beach, even though there are a few hits there, but most of them are for North Miami Beach, which is actually a different municipality altogether. So there's only one Miami Beach nursing home, that's this one here. So I'm going to click on it, and I'll walk you through that example. So I just showed you one way to access this. You can either type in the name of a specific provider, or you can type perhaps a zip code or a city, comma, state. So I've typed in Sands at South Beach Care Center. It's not very far from where I am now. The first thing to notice is that this user experience is organized around answering questions rather than burden the user with trying to think of the right questions to ask, as well as to hunt for the answers. Here, the user experience is organized as questions there on the left. The core questions of benchmarking. How is this performance entity or provider, let's use the word provider, how is this provider doing? In other words, where is it doing well, or where is it standing out in a neutral way as well? Where is it doing less well, or where could it improve, is the phrase used there. What things have changed for this provider over the last year or two, say, compared to everybody else? What's the best that is achievable by a provider of this, who looks like this provider, somebody who's similar to this provider? And then the fifth question is a little bit different. Where does it stand in its county? And I'll get to those. So I typed in the name of Sands at South Beach, or we clicked on it, and we see that it found 7 things to say about where this provider stands out compared to others nearby or nationally. If it found nothing, nowhere that this provider stood out, let's say it's middle of the pack and everything, it might say found nothing. In most cases, it finds something. So here it found 7 results. There are other ways to compare providers, by the way. I don't have time to show everything, but one could click here and compare based on all measures, not necessarily looking for standout behavior. Just show me a comparison, even if a provider is middle of the pack. But I don't have time to click on that or to go into that. So here it tells you a few different places where this provider stands out. Let's click on the first one. So it says that this provider is actually the 12th largest in terms of certified beds. Of all the nursing homes in the Southeast, they're actually doing quite well. They have a 4 or 5-star rating in all of those measures: overall, quality, staffing, and RN staffing. And besides saying that it is quite a large nursing home, among all those that are doing pretty well along those dimensions, it also mentions a few other things. Besides the number of certified beds, it'll tell you how many residents it has and the occupancy rate. And then here, this is a very simple insight, but we offer visualization as a way to complement the language. By the way, one of the other, among those 10 innovations that I mentioned, besides organizing the user experience around questions and their answers, the second dimension is the insights are delivered as perfect English paragraphs, and another aspect is with rich supporting context. Okay, this is a very simple example of a supporting context, and we'll see others. The principle there is after you tell somebody, a user, an insight, think of the questions that user might have next, anticipate them, and give them the answer to it, rather than burden them with thinking, what else should I know that's highly relevant to what I'm seeing now? Of course, you have to do that with good judgment. You don't want to overload the user with too much information. So you could click on Visualize, and then it would provide just a histogram where here is Sands at South Beach, and you can see who the other ones are. It's just a histogram, and this is all public information, so you don't have to anonymize anything. This is the biggest one here. Somebody in Orlando is the biggest that's doing well in all those dimensions. So let's close that. Here's some other information. It talks about peers. So if it's the 12th largest, it tells you who the others are. You can hover over them, and it'll tell you a little bit about them. And you could see who are the ones that are smaller in that peer group. The peer group, again, is everybody who's doing pretty well in all of those star ratings. Okay? There's also take action that is triggered by the specific details of the insight. We don't put anything there. We might in the future collaborate with someone who would have something valuable to say to the user based on the specific detail in the trigger, in the insight. But right now, we just put this kind of vanilla information. The references are where the data comes from, so they all come from Nursing Home Compare, but we also add some other information. Sometimes the data doesn't come from Nursing Home Compare. For example, region of the country, we use a standard definition for region of the country. So if you are in Vermont, that's New England. If you are in Pennsylvania, that's Mid-Atlantic, and so on. Okay, so these are the references. And then also you can click on Profile and get a big dump of everything that the software knows, has been told about this provider. All the numeric measures as well as all the symbolic measures. This is only for if you want to search something in particular. Okay, this is just a kind of a reference. By the way, you can also download a complete PDF report, which I tested already before this call. It's about 55 pages and tells you everything, all the insights on this particular nursing home as delivered as a PDF. It takes about 30 seconds to create it. I've already created it. That's why it saved it and says just download it rather than create it. If I have time, I'll show you that later. Okay, so this is insight number 1 out of 7. All right, and let's go now to the second insight here about how is this nursing home doing. So this nursing home is the third fewest long stays who lose too much weight among everybody within 20 miles. And that is quite a bit less than the average across those other 57 nursing homes within 20 miles. And let's remind ourselves of the size of this nursing home. It has 180 residents and certified beds. It has an overall rating of 4 stars, and it's a nonprofit nursing home. Okay, so this is another example of context. If you're told that somebody is doing pretty well, you'd like to know what is the average across that peer group, which the software just came up with. The peer group here being within 20 miles. Okay, so this is a second insight. Which it could be either good or neutral as an answer to this question. If you want to see how many of each there are, you can click on Select Judgments, or it has 3 neutral things to say. Neutral means there's no value judgment about whether it's better to be bigger or less or smaller on a measure, for example. If you want to get a quick look at what those are, okay, long stay residents who received an anti-anxiety or hypnotic medication. In configuring the software, we consider that to be a neutral measure. We report it, and we report insights involving it. But in configuring it, we don't say that it's better to have more or less of this medication. We do that for another one, which is the antipsychotics that's been in the news a lot, but not for this one. And that, of course, can be changed if we are told or convinced that something should be neutral instead of positive in a particular direction. Okay, let me go to where could it improve, where this nursing home in Miami Beach could improve. And I'm going to click on a little bit of a more complex insight in this case to illustrate another novel aspect. So here it found 11 things to say about where this nursing home could improve. In other words, where it's not doing so well in certain ways. I'm going to click on this third one. So I'm going to pause for 5 seconds to let you read that first sentence. All right. This is a very unusual type of insight in benchmarking. This is one of the novel aspects of this approach. I actually wrote an article on this that's available from benchmine.com, and I introduce it with a humorous example. Suppose I benchmark Joe, our friend Joe, against everybody else, and we found an insight that says that Joe has the ugliest wardrobe of everybody as good looking as he is. We could tell him that as a motivator to dress better. Has the ugliest wardrobe of everybody as good looking as he is. It turns out that if you create software that finds such insights, there are many of them that are available. In this case, what we're looking at is among all the nursing homes that don't medicate with anti-anxiety medication so much, this nursing home medicates with antipsychotics the most of everybody, of all those 142 nursing homes. So in that peer group, it's prescribing antipsychotics quite a bit. And in fact, here's some supporting information. The long-stay antipsychotics is the most among those 142, but look at the short-stay antipsychotics. Actually, middle of the pack. So there's a big tendency, maybe there's a good reason for this, it's outside the scope of this reporting, maybe there's a good reason for this, but it is what it is. If you want to visualize it, the visualization is a little bit different because there are two numeric things in play here at the same time. So the visualization is a little bit different. It's saying that this nursing home is alone in this yellow box. In other words, and everybody who on the x-axis is below it here, this nursing home has the highest value, in other words, antipsychotic medication for long stays on this y-axis. So it's really an outlier. Maybe there's a good reason for that. But the task of the software is to report this outlier behavior. In this case, the software was configured to say that a large amount of antipsychotic medication is a bad thing. That's why it reports it as something bad. If that were the wrong decision, and instead that should be neutral, then one changes it and then pushes a button again. Okay? I'm sure you might have questions, but I think everybody's muted, so I'm going to proceed and wait for questions until later. Okay. Let me look at the third insight, third question here, which is, let's see. Let me go here to where has it changed. In this case, it's the answers to this could be good or bad. We decided to organize all change insights under this question rather than break them out separately into good and bad. You can see that here in the filters, if you see all the judgments, there's one good and two bad things here. And the first one says that it has the third biggest drop in overall rating over the last 2 years of all the nursing homes in Miami-Dade County, which is where Miami Beach is. It was not a huge drop, it's just -1, okay? But the average in Miami-Dade County was improving, was plus 0.04 across those 53 nursing homes. And that -1 represented a drop from 5 stars to 4 stars. And then here's some other supporting context for the user to evaluate whether this drop is important, if it calls for some investigation, some analysis, etc. So provide some brief supporting context to help the user make those determinations. Okay, so a fourth question is what's best in class. I don't have time to go into it, but it's a little bit of a different question. You can click on a particular measure, and then it'll compare this nursing home against, say, the 20 most similar, and will reveal who does the best on a particular measure among those 20 most similar nursing homes to this one. Okay, but I'm going to skip that for now. Now, when I go down to the bottom here, I can download this PDF report. I'm going to click on it. I had already created it. It takes about 30 seconds to create. So I had already created it. So I'm just going to quickly show it to you here. So see the questions. These are basically the same questions as before interactively. And you can scroll through it. It's 55 pages long, and it's got each of these insights on its own page, so you can read it on the bus instead of using a computer to look at the insights. Of course, not as interactive, but it is a PDF report. Okay, By the way, everything I'm showing you here, you could do yourself. You wouldn't have me walking through it with you. But all of this is open, public access, offered for free. That's the strategy for a company. We want to make a positive impact in these healthcare sectors, and we're offering these benchmarking engines free and open access. Okay. And then the final thing here I want to show you is we came up with a score. Some people asked us for sort of a consumer-friendly way to summarize these insights. So we have a score. I'm going to click on where does it stand in its county. So the county is Miami-Dade County down here in Florida. And the nursing home I was looking at was this one, Sands, which had a standout score of -8. The lowest standout score is -18 in Miami-Dade County, and the best one is 16. What the heck is a standout score? Well, a standout score basically counts up or sums up all the positive or favorable insights, subtracts all the unfavorable insights, and then subtracts what we call the ambivalent insights, which is like Joe has the ugliest wardrobe if everybody as handsome as he is. You get -1/2 for those. And for the neutral insights, it's just a 0. And it just counts them up. You could do that by hand, but it does it for you. And it gives you a quick idea of how that provider is standing out compared to everybody else nearby and nationally. Okay, so each of these healthcare benchmarking engines has its standout score. I want to show you a couple of other things before my time runs out. So let me exit full screen. And I want to go back here to the entry search box. Okay, the nursing home search box. And I'm going to show you another way to address or to make use of everything that is created here. Let me point out that all of these insights for the nursing homes are done offline before the user does something. In this case, it runs for about 4 days. In fact, Nursing Home Compare just updated its data late last week, and we reconfigured it, our engine with the new data. It's running. It should be done probably by Friday afternoon. For sure, on Monday, we'll have it live with the newest data update from Nursing Home Compare. Depending on how you count, it generates about, let's say above 30 million words of grammatical sentences and paragraphs for the 16,000 nursing homes. So 33 million words, roughly. Compare that to, say, all the words in the 7 Harry Potter books combined, which is about 1 million words. The software uncovers things worth saying and writes them up in perfect English. Once you have those things created, this encyclopedia of insights, and you can query it in a very different way, and that's what this button here especially is for. I can do a query not for an individual nursing home, but I could do a query across nursing homes. Let me show you an example. Suppose the question I'd like to answer is, in Miami-Dade County, where I am now, show me the top good and bad things that are happening across all the nursing homes in that county. So, across all nursing homes for which the county is Miami-Dade, show me the top insights that mention that, and I'm not going to specify anything. I'm just going to click go. I don't have to mention anything more. I'm going to click go, and then it takes that encyclopedia of insights and picks out the top good things happening at larger nursing homes. For this question, where are notable achievements? And then also the top bad things that are happening among larger nursing homes. So I could click on this one. Let's take a look at this one. So this one, for example, this one. This nursing home has the 9th most short stay who newly received an antipsychotic medication among all the nursing homes in the country. And there's been a lot of controversy about prescription of antipsychotics, so there it is. It's a very large peer group, everybody in the whole country, and it's got the 9th most prescriptions of antipsychotics. And let's take a look at the size. It's not small. It has 116 residents. Okay, so using this button, this query across nursing homes, you can pose all sorts of other questions that go across nursing homes, like a very simple one: where are top good and bad things happening in Miami-Dade County? There are many other ways to access that big blue button, but I don't have time to go into it. Let's see. Let me show you just a couple more things before I run out of time. Let's see. All right. Actually, I want to show you how another type of helpful insight that the software can deliver. In this case, for providers, not for consumers. Okay. So I'm going to actually go back to Miami-Dade County here, and what I want to do this time, Miami-Dade County, is to show me the top insights that mention a low level of total staffing. Total nurse staffing. So I'm across all nursing homes for which the county is Miami-Dade. Show me the top insights that mention that total nurse staffing hours per resident is, let's say, low. Okay, so if total nurse staffing hours is low, then that's an improvement opportunity because we've configured it to say that total nurse staffing hours better is higher is better. So let's take a look at this first one. Has the fifth fewest staffing hours per resident per day, and it's a big one, 268 residents. That's why it showed up first rather than whoever has the most, or anywhere from the most to the fourth fewest. Okay. What I want to show you here is that the software is told a little bit of an algebraic relationship between these things. So it inserts this thing, that reaching the average of 4.3 total nurse staffing hours, in other words, from 3.78 to 4.3, would imply this extra nursing staff per day, assuming an 8-hour workday. Okay, and it has some supporting information about the total nurse staffing hours, etc. So that's another thing that could be done. If the software is told an algebraic relationship, it can suggest certain things like that. If an action were taken, for example, reaching the average of that peer group, what would that imply? Okay. So I'd like to just finally point out that we are taking steps to make these things more user-friendly for consumers who may not understand a lot of this stuff. We don't have this for the Nursing Home Compare engine yet. We will have it by Monday. But very briefly, I could show you the hospitals engine where we already have made this live. And if I go to hospitals here, let's stick with Miami Beach. There's only one hospital in Miami Beach. I know because I've done the search, not because I've been there. God forbid. So if I click on Miami Beach Mount Sinai Hospital, and let's say I go to this insight number 2, where it says it has the highest overall hospital rating among all the hospitals in Miami-Dade, this is what it tells you if you're a consumer, which we've configured the default audience to be consumer. Now I'm going to toggle the audience to professional, and you're going to see something appear here which is a little bit different, which is not of interest to a consumer, but it may be of interest to a professional. So it actually points out that even though hospital rating overall tends to correlate or to rise together with nurse communication rating, in this case, Mount Sinai is even worse than the median of those 21 hospitals. Even though it's doing well in a hospital overall, for some reason, it's doing actually worse than the median in nurse communication. So it might be of interest to providers or their the steering committee of a hospital to inquire why that should be. Okay, so I'm going to finalize. We will have a new nursing home engine live by probably Monday morning, if not earlier. Everything I've showed you is public and free and open access. You can enter a Pennsylvania nursing home if you like and explore what it has to say. The new nursing home data is basically the same in terms of measures as the old, with one exception. They introduced long-stay hospitalizations as a new measure. So the number of hospitalizations per 1,000 long-stay resident days. and that new measure will appear in the engine that we configured. So we updated the configuration of the engine to include that new measure, and that should be live by Monday. So I'll close there and see if anyone has any comments or questions. Turn over to Chris, I guess.
Thank you, Raul. Wendy, do you want to unmute everybody and see if anybody has any questions for Raul?
Actually, everybody, I think, can unmute themselves. I will click on those. I think most everyone is self-muted. So everyone can unmute if you have a question, and if not, you can type them into your question pane. But I believe I'm going to unmute those who I've muted, but everybody else is never mind. We're kind of going by, we're doing things a little differently here. All right, any questions?
Chris.
Muted everything that I can.
And if you don't have any questions, does anyone have any feedback for Raul?
Hi, Raul. This is Denise Curry from HCR Manor Care. I really think this is a great program, or I guess web-based analytic. Can you reiterate what the standout score means? I think I have the definition, but I just want to make sure.
Sure. I'm going to click here on Score Nursing Homes. So whenever you see the word score, that means standout score. And then there's a description at the bottom here. So basically, take all the positive comparative insights, sum them, and then subtract all the negative comparative insights, and then subtract 1/2 of the ambivalent insights. And then that's the standout score. So for this one, let me go back to this nursing home. Where was it? Well, let's pick a new nursing home. How about this guy? Okay. So here's question number 1, and there are 2 good things and 3 neutrals. So you get 2 points for the good things. Let me click here. So there are 9 bad things. So 2 minus 9 is -7. And then here, where has it changed? Okay, 5 good things. So -7 plus 5 is -2. So that's a standout score of -2, which should be down here. There it is, -2. That's the standout score, which is documented on the initial page that I showed you here on Score Nursing Homes.
Thank you.
We're not saying that this is where you should take your mother, okay? All we're doing is giving a score based on the positive and negative and ambivalent insights that come out of here.
That answered that for you, Denise?
It did. Thank you.
Raul, do you mind showing everybody a comparison of facilities in the area with the charts that are there that they can hover over to see who's around them on each metric?
Sure. Yeah, I didn't have time to show you that, but let's do it. Do you want to tell me a nursing home?
Have a facility they want to look at?
If everyone can self-mute, and then if you want to say something, you can unmute yourself. We're getting some feedback, some noise in the background. Thank you.
Denise, can you give us a building that Raul will look at for you?
I could just take somebody in Pittsburgh.
You can pull up Schuylkill Center if you want.
Could you repeat that slowly, please?
Schuylkill Center.
Which center?
Schuylkill. Schuylkill.
I'm hearing Google. I'm hearing Google.
Yes, Schuylkill.
Here you go, Raul.
Google.
Schuylkill. It's SCH.
Y.
Y.
I'm sorry. SCH what?
Y.
Y.
Oh, UY. I'm sorry.
UI.
UY.
UI.
There at the bottom.
This one? Pottsville?
Yep.
Okay. All right, Pottsville. Where is Pottsville? Is that out east?
In the
I guess.
middle,
Okay.
It's in the middle of the state.
Okay. So here's one thing that we learn from visits to nursing homes is that very often a nursing home administrator, most especially, wants to compare his or her nursing home to everybody within, say, 7 miles. So we added a capability for that. So let's benchmark this nursing home, this center, against a group of nursing homes that we select. Okay? So I can pick the criteria. The criteria could be anything that the software knows about, but let's just say, let's compare to everybody within X miles, where X is 7. Okay? That's a number I heard a lot. Although maybe in Pottsville, I don't know, maybe there aren't that many within 7 miles. I could pick a different number, but let's find out. Okay, there are 6 nursing homes within 7 miles of this one in Pottsville, okay? In this case, it doesn't generate the comparisons as English paragraphs because, remember, to do that, the software runs for 4 days offline before the user does anything, okay? But it does here on the fly compare it and creates diagrams. So here, it's showing everywhere that this center is better than the mean of the other 6 nursing homes within 7 miles. On different metrics, so you can hover over them and see them. The red is Schuylkill, and then the yellow is the median, and all the others are visible because this is all public information. So everywhere here, it's doing better than the mean of all the others within 7 miles. So in a lot of ways, it's doing better than the mean. Wow, a lot of ways, okay? And if you want to see where it's doing worse than the mean of those others, then we could click here, where could it improve, and see what it says. It found a smaller number of places where it's doing worse than the mean. Okay, this is only on measures that have a value judgment attached to them. So, for example, the number of residents in a certified bed, you can't say that it's better to have more or fewer from a patient care point of view. So it's just the ones that have a positive direction associated with them. For example, pressure ulcers are not good. It's better to have fewer, right? So in this case, for pressure ulcers, the value for this center is 0.67%, and the mean is 0.39%. Maybe not a huge difference, but it just does report where it does worse than the mean. Okay? So this is a very simple way to compare yourself to a group that you care about especially. You know, for example, everybody within a certain number of miles, And to get diagrams like this, you're not going to get language with supporting context, but you are going to get diagrams on the fly, and you can download them as well by clicking on this, and you'll get the images.
Thank you, Raul.
Thank you.
Thanks, Nancy. I think that was Nancy with the feedback I'm trying to figure out. Anybody else have anything else for Raul? All right, well, I'll take that as a no. And Raul, thank you for showing everybody Benchmine today.
You're welcome. Thank you for your interest. And if somebody has any follow-up questions, I'd be happy to answer them. Also, sometimes we do get inquiries from media about nursing homes, what they do with this information specifically. If someone is interested in talking with media about that aspect, please let me know. And otherwise, thank you very much, and goodbye.
Thank you.